So, welcome to the Osteoarthritis Action Alliance Lunch and Learn for October 2015. My name is Kirsten Ambrose, and I appreciate all of you taking the time to join the webinar today. I'm pleased to introduce our presenter, Basia Belza. Dr. Belza is the Aljoya Endowed Professor in Aging in Biobehavioral Nursing and Health Systems at the University of Washington School of Nursing. Dr. Belza's expertise is in the dissemination and implementation of evidence-based and community-based health promotion programs for adults with a focus on physical activity and interventions. Relevant to today's presentation, she has led a CDC-funded mall walking project that included conducting systematic audits of malls and other venues for walking in 5 states and interviewing 50 mall walkers and managers. One program in Seattle was featured on the local news there. Dr. Belza will tell you more about that and share some of her latest research with us today in her presentation titled Shopping for a Healthier You, What Mall Walking Can Offer. Welcome, Dr. Belza.
Thank you very much, Kirsten, and I very much appreciate the invitation from the Osteoarthritis Action Alliance to spend this half hour with you on this Lunch and Learn. We are in the midst of a sitting epidemic. Older adults are the fastest growing and the most physically inactive demographic. And yet we know that walking can have significant positive effects on health, and it's actually the preferred activity for midlife and older adults. Research also has shown us that walking actually encourages a stronger sense of community. People who walk in their neighborhoods and surrounding areas actually feel a stronger sense of connection to both their neighbors as well as their neighborhoods. I propose that we're in the midst of a walking revolution. Many of you will recognize our friends the Beatles on this PowerPoint here. And although individuals themselves have to make the decision to walk, the decision actually can be made much easier by improvements to community walkability and by programs and policies that provide opportunities for walking of all ages, although I'm particularly going to be focused on midlife and older adults in this presentation. And we can really all work together to really make walking a national priority. And there is a role then that exists for all sectors of society, including transportation, land use, community design, parks, recreation and fitness, businesses, nonprofit organizations, healthcare, media, and public health. And to that end, I was real pleased when just in September, our very own Surgeon General released the very first call to action on walking and walkability. There's an incredible number of resources that he and his team have made. They are available on the CDC website. Clearly, our Surgeon General has a strong belief in the value of walking and its role in improving health and reducing the risk of illness and injury. So again, I call your attention to the CDC website for the Surgeon General for a large number of resources for improving our communities as far as walking and walkability. And interesting enough, November has been designated as Mall Walking Month. So I'm here to share with you some of our findings from our mall walking program project. This was a one-year CDC-funded project in which we explored different aspects of mall walking. And the green states on this particular slide are those where our consultants, our co-investigators lived, and the states in which we collected our data. And the people across the bottom parts of the screen are my collaborators. The overall purpose of our one-year project was to evaluate the evidence and practices of walking programs. And we focused both in malls, but we realized that in many areas of the country there may not be closed, safe, functioning malls. And so we also looked at other venues in which there were walking programs for midlife and older adults. The methods we used were several. First, we did a scoping review of actual mall walking programs. So this was a rigorous review of the literature of what has already been researched and found out and published about mall walking programs. We also did audits of shopping malls and other public venues, and we used our modified version of the CDC Healthy Aging Research Network environmental assessment tool. This tool actually includes assessing various features, both in the external environment, such as public transit, parking, entrances to and from, let's say, a mall, physical and social order, as well as things internally in the environment. So these may be wayfinding aids. They may be amenities such as bathrooms and drinking fountains. It might be the actual physical order of the place. And then we also looked at the walking environment. What kind of hours were there? What resources were there available for the walkers? Were there routes set up? And what were the conditions of the malls? So through that environmental assessment tool, we were able to get at both internal, external, and walking environment features. We also observed mall walkers, and we used a tool by McKinsey called the SOPARK, which is a system for observing play and recreation in communities. It's also very useful to use to observe mall walkers. And through this tool, we were able to look at physical activity levels, gender, types of modes of transport, such as if people use walkers or canes, as well as we were able to estimate age and ethnicity groupings. So you use a momentary time sampling method so as you can quantify the number and the activity levels of people who use a specified space for physical activity. And then we also conducted interviews of mall walkers or other venue walkers, managers, program leaders, both in malls and public venues. We had a wonderful team of both students as well as investigators. We had operations manuals so that we would consistently collect our data across our states. So I want to go over the results, highlight the implications of these. So the first part of our project was actually a thorough scoping review in which we looked at 37 published studies. This work has been published in Preventing Chronic Disease, so if this is of interest, you can get more details in that article. We looked, so the findings from the scoping review were really couched within several areas. We were able to learn about program features, so this might be mileage logs, it might be warm-up exercises, walking route maps, or blood pressure checks. So these were all things that we found in the literature that existed related to mall walking programs. We also were able to look and see that there were certain environmental features from the scoping review. So appealing environmental features were that malls were safe, they were accessible to the community, and they were well lit. The scoping review also revealed some very interesting partnerships. These would be partnerships between malls and hospitals, malls and senior housing, and then malls and other types of nonprofits or city governments to support the mall walking program. And then from our scoping review, we also noted a number of benefits, both to individuals as well as to businesses. Individuals reported significant physical, psychological, and social benefits. And then actually malls themselves noted their role as far as helping improve local residents' health as well as building community. So in addition to the scoping review, we also conducted these walking audits and observations. This work also has just recently been published in the Journal of Physical Activity and Health. Again, if you're interested in more details, you can go to that particular article. And we did do audits in 5 states, and we did audits both of malls and non-malls. So again, as a reminder, the states were Alaska, Illinois, Missouri, Washington, and West Virginia. And we wanted to do the malls because that was a primary focus, but we also wanted to do non-malls because, again, we realized that malls aren't necessarily available in all our communities. So non-malls, we did not include fitness facilities, work sites, or tracks, but we did look at businesses that had actual walking programs. So these included indoor ice rinks, outdoor botanical gardens, an outdoor zoo, and a former mall that actually had been repurposed, and a former factory that also had been repurposed. And then when we were in the malls and non-malls, we also looked at the walkers, and we observed them for speed, age, ethnicity, gender, and if they used mobility aids. So what we found out with the audits, so this is actually when we went into the malls and the non-mall settings, of our malls, we noticed that all of them had public transit stops and they had accessible parking. Most of them had wayfinding aids, so as to help people navigate around the mall. They had established walking routes, they had even floor surfaces, benches, and clean restrooms. Really important to our older adult population. The venues varied in their access hours, the types of programs they had for mall walkers, the hazards, such as if there were any tripping hazards, the traffic control near entrances, and the lighting adequacy, although most of them did fairly well in all these areas. And then despite the diversity in the location, the size, and the purpose, the venues were fairly consistent with regard to environmental features that were very conducive to midlife and older adult walking. So those of you who are less familiar with mall walking, typically what a mall does is they may open their doors, for example, at 8 o'clock. That's when the security guard shows up. The individual retailers may come in and start opening up their stores or doing their business, and then this is but they don't open them for the public yet, and this is a time when the mall walkers come out, typically between, let's say, 8 and 10, actually before the actual doors of the individual retail places open. So this provides a good hour and a half for the mall walkers to be there. If any of you have been going shopping early before the stores open, I'm sure you've seen them. They're typically very dedicated walkers, and then more traditionally, after they finish walking, they may gather around some tables, they may share some coffee, and they continue their socialization. And we've seen this similar practice across the United States. We were also interested then in what was happening in other public venues that were open to walking, and so in each of our states we went to a variety of these venues. On this particular slide I show two of them that we visited and assessed here in the Seattle area. One of them is a very active senior walking program at our Woodland Park Zoo. In that top slide you can see the group stretching. This is a wonderful partnership between the zoo and the Group Health Cooperative. Group Health sends a staff member over to lead the adults in their stretching before the walkers then go into the zoo for their walk. This is before the zoo is open to regular members. Again, it's a flat surface. It is outside, but the zoo walkers are very thrilled by the beautiful environment and being able to see all the animals. In this particular setting, we did find out that a lot of the zoo staff enjoyed the walkers there. They really felt that they were their ears on the ground, eyes on the ground, so that they could see early morning what was happening with all the animals. Some of these people have been coming to the Woodland Park Zoo as a zoo walker for the last 20 years. We also explored another area. This is in Everett. This is one of our arenas, and we had a walking program there, and the folks there established it 3 times a day. And what was interesting about this particular walking program, they also extended it to a local school that had children with disabilities, and you can see those images where one of the staff at the arena actually helped facilitate the walking of the children who did not actually have a gym in their school. So these are two types of examples of where we have walking outside the mall, but very effective then. When we looked at observing the walkers, these are our general findings. We noticed about 3/4 of them were older adults, so we did notice that another quarter actually were mid-age, or they were moms pushing their kids with strollers. About half of them were female, another half male, so it's a great opportunity for males, older adult males, as far as getting exercise. Very few of them use walking devices, which I think is an interesting learning for us, that might be an area that we could increase as far as the target population. And a good quarter of them were ethnic minority. Again, a lot of that was contingent upon where we actually were collecting our data from. And most of them actually walked at a fairly moderate pace. So we then also conducted interviews, and again, this was 27 interviews that we conducted with walkers. We used the same interview guide across our 5 states, and we had some very similar findings. So what the walkers told us is they really felt a strong sense of community. There was no pressure to come walk, but they did find that people checked in on each other if they were not showing up. Most of these programs are held 2 to 3 days a week, and those who walk developed some really strong friendships, and they're very inclusive of new walkers too. Many of them cited the multiple health benefits. They talked about if they had had some rehab, that they came back to walking as quickly as they could, that they found physical benefits as far as keeping strong, reporting less falls, feeling better psychologically. So multiple health benefits were noted by the walkers. They felt it was a safe environment. Many of them would know the security guards that were on the premise. The climate controlled was ideal, anywhere from the cold in Alaska to the rain in Seattle to the snow in Chicago, that people really liked the climate controlled feature. There were benches available, and many of them had established walking routes so that older adults could actually tell how far they were walking. And this is one of my more favorite quotes from one of our walkers: "Mall walking is like a drug. If you miss a day, you really feel it." We also interviewed program leaders, and these would be individuals who might be running a mall walking program. This is an example that we have here where there's a kiosk. Mall walkers come in, they check in, they get their blood pressure checked, they walk, and they talk to the staff person who actually is from the Y. This is a partnership between the mall, the Y, and the Overlake Hospital. Program leaders tell us there's a great sense of community, there's a lot of inclusivity, and in fact they notice a lot of health benefits from their participants. And here's a quote from one of the program leaders: "It has been good to see the walkers become committed and benefit from the walking, like losing weight, lowering high blood pressure, and making new friendships." So the third group we interviewed were actually mall managers. These were individuals who actually worked in the mall. They were the staff. Some of them also were program leaders, and they too noted the benefits to the walkers as far as health benefits. They too described the business benefits, although this was harder for them to capture. They didn't know how many people actually did go shopping, although we do have anecdotal reports from the walkers who said that they knew where to shop for their husband's Christmas present, or they would shop immediately after their walking before they headed home. The managers themselves noted that excellent climate-controlled aspects, and they really liked their mall being associated with wellness. I think we've seen changes as far as people's shopping behaviors with a lot more online shopping. I think malls are being very creative in looking at how to create the mall as a community for people to come, not just to purchase items, but for entertainment and other activities. And here's a quote from one of the mall managers that said, "We offer the mall walking program as a community service, to be part of the community and to invite the community in." From our interviews, from our audits, and from our scoping review, we did develop what we are calling the Mall Walking Program, a resource guide. This is available to all of you. I have included the URL on this PowerPoint. If you just Google CDC Mall Walking Guide, the PDF will pop up. We're real pleased that CDC actually has distributed this to 800,000 of their email subscribers. We've gotten a lot of visibility for people interested in using this guide for a number of reasons. One, to be able to explore best practices, and to really look at ways to either start a mall walking program or to further build a mall walking program. So this was really targeted to inform policymakers and planners, but also mall and building managers, community coalitions, aging service providers, and public health professionals, both in the development and enhancement of mall walking programs. So this guide, again, is readily available. We're very appreciative of the multiple contributions we received from the different malls and the non-mall walking venues. So we do feel that there's some multiple implications of exploring and activating mall walking programs throughout our communities. We really feel that through mall walking programs, we would clearly have the potential to achieve our Healthy People 2020 objective as far as reducing the proportion of adults who have no who engage in no leisure time physical activity. So we believe that mall walking is a ready accessible venue for many of our midlife and older adults who may not be interested in or have the money to be able to go to clubs, may not be interested in group exercise, but may be interested in walking. We also feel that we can reach a larger ethnic population based on where malls are located in our cities. And we also, through mall walking programs, have the potential to increase the number of people who meet the physical activity guidelines for Americans. So we feel that mall walking programs are this large untapped resource, and although they've been around probably since the early 60s, originally started for cardiac rehab, we feel that there's a rebound for them. We're very appreciative for all the work the Surgeon General has done to call attention to walking and walkability. We're excited that November has been established as Mall Walking Month, and we are excited to be able to support, again, the growth of mall walking programs and the start of new ones. I very much wanted to acknowledge our team. This was a wonderful collaborative effort. Again, we were located in 5 different states. Our definite appreciation to our CDC scientific officer, David Brown. We've had wonderful staff. We really use this also as a venue for graduate students to actually learn a little bit about research and about community partners. And again, very appreciative of all the mall walkers, managers, and program leaders who participated in our interviews. So in closing, some of us do our best thinking when we are walking. So I'd like to close on this slide and then open it up to any questions or comments.
Thank you, Dr. Belza. That's a really nice look at not just mall walking, but I have to say I didn't appreciate the scope of the program and taking it really outside of malls as well. I thought the zoo was a great example and a great idea of a place that's really sort of entertaining and enjoyable and would bring people out there.
Kristen, I actually wanted to comment on that because many people may not think of malls as being appealing places. Those people who walk in malls actually talk about how the windows, the decorations change, the fact that it's climate controlled is very appealing. And then the group that doesn't like the malls really do like these other venues. The Botanical Gardens in Chicago is gorgeous. The zoo here in Seattle is gorgeous. And yet there are limitations if it's not climate controlled. So if there are ways to provide menu of options to people so that on rainy, cold, wet days they explore malls, but on sunny, clear days they're outside, I think that's a win-win for all our communities.
I agree, and I was actually going to bring up, as we're waiting for anybody who has a question, just a quick reminder, you can type those questions into me or you can raise your hand and I'll unmute you. But the one thing I was going to bring up is that so much of what we do or are trying to do here in the OAAA Action Alliance is bringing physical activity programs for arthritis out into communities, just as you've done here. And one effort that's extremely hot off the presses, in fact, we have our first effort coming up, our first session coming up on October 31st. I don't know if you're familiar with the Walk with a Doc program.
Yes.
Yes. So Amanda Nelson here at the Thurston Arthritis Research Center is, we have learned, the first rheumatologist to bring a Walk with a Doc program anywhere in the country. So we're not only excited about that, but that's also, I see a lot of parallels with the mall walking program in a way that perhaps those programs can get together or share some commonalities or benefit from the findings that you have in your efforts to audit locations and such. You know.
So Walk with the Doc is an incredible program started in Ohio by a cardiologist who wanted to walk more with his patients, who realized that physical activity was an important part of the prescription package that he was delivering, and so has started these Walk with the Doc programs. And I think one of the things we'd like to also see is that we see walk with other professionals too. So we have started engaging some of our local retirement communities to see if we can have walk with an executive director. We find that, for example, retirement communities, executive directors are very popular people in that community, and we're thinking if they can set us a model and go out and walk in the mall that's up the street, down the street from them, that might be an engaging way for residents. We started thinking about how to walk with a professor so that you might be walking with someone from your local university. And we've also started thinking about doing walk with a physical therapist. As we know, many physical therapists have a great relationship with their clients. They're a trusted provider, and I think clients might like to see their physical therapist out on a walking trail. So we've started to explore some of these other ways to go beyond just walk with the doc, which I think is totally in line with walking with someone in your community. So again, I invite everybody to explore how this might work within your community and with the constituents that you work with.
I agree. I think that's a great idea. I have a good friend who's a professor here at UNC, and she often goes on a run with some of her graduate students, and they talk about, different work that's going on. Of course, it gets a little bit social too, but it's a great way for them to connect outside the office, and something they both enjoy. It's a healthy way to get the juices flowing and talk about some data and what have you. It's not perhaps the first way you would think of doing it, but it works really well for them.
So one of the other things I might mention as far as this guide, Walk with the Doc was consulted, and so we had a number of other groups that have worked with us in the guide. We've had the Arthritis Foundation, we had Evidence-Based Leadership Council, we've had Easter Seals, so we had a number of wonderful partners who helped support this guide. So I'd like to acknowledge their efforts too.
Well, the last thing I was going to mention was I know that you were, you mentioned it in today's talk about the Surgeon General's call to action that came out in September, and in truth, that was part of the impetus for us getting tuned into the Walk with the Doc, and Amanda saw that that program shortly after the Surgeon General's call to action came out, and I think that's a great way. We've been trying here at TARC and with the Thurston Arthritis Center here at UNC, as well as the OAAA Action Alliance, to leap from that Surgeon General's call to action and actually do something about it instead of just have it sit there. So, of course, which is the point. But looking for ways that we can actually encourage walking and walkability. And we've got a few small grants that we recently awarded out in 3 communities across the country that have one in Seattle, in fact, the Associated Recreation Council of Seattle, and a group in Arizona with Arizona State and a local Indian reservation community, as well as a wellness program at Texas State, all of which have included walking and walkability audits and are promoting some sort of education and physical activity, access to physical activity programs for the members of their community who have arthritis. And in that small grant program, we put an RFA out. We could not believe the response and how much people really are looking for resources like this out in communities.
I think the resources as well as the partnerships, and being very creative as far as who to partner with and really to make our communities more walking friendly. We will be presenting more detailed results of our work, both at the Gerontologic Society of America meeting in November and then also the American Society on Aging meeting in spring. So for those of you who are listening to this webinar, please come up and introduce yourselves to us at that meeting, and we'd be happy to engage in more creative ideas as far as improving walking and walkability, and in particular the utilization of malls to help facilitate that.
And also check out the website on the OAAA Action Alliance, I should say the web page, announcing Dr. Belza's presentation today, because she provided us with a couple of PDF articles and video clips and such that go along well with her presentation today. So do check those out when you have a chance. Briefly, I just wanted to mention, since we're coming up on our half an hour here, that we have our next webinar on November 18th with Dr. Maury Everson from the Department of Physical Therapy, Movement, and Rehabilitation Science at Northeastern University. So check out our website events page for more information on that. And once again, I just wanted to thank you, Dr. Belza, for a great webinar today. Very interesting to explore mall walking and beyond.
Thank you.